Good evening, people of the world, and thank you for joining us for this special Ask a Scientist Live, organised by the scientists for XR. And it's my pleasure to introduce you to your host for this evening, Dr. Alison, Director of the scientistswarning.org.
Hello, everyone, and welcome. It's my pleasure to be your chair for this event this evening, or it might be morning or afternoon, depending where you are on the globe. So this is our second Ask a Scientist live event, and it's brought to you by Extinction Rebellion scientists. Our last event was watched by around 25,000 people around the globe, so it's amazing and it's wonderful that we've got such a great audience and so many of you out there tuning in. I'm in Cambridge today, and we have four panelists who will be answering some of your questions later on, and they are spread around the globe too. They were taking your questions on our topic for discussion today, which is this: the climate and ecological emergency versus COVID-19, and why have people reacted differently to these crises? Now, we're all psychologists on the panel, and myself too, and we'll be looking at this very much from a psychological point of view, and we'll be focusing on the risk perception, judgment and decision-making aspects, and communication, and how to affect behavioural change. So we'll be looking at those angles in particular. So when you submit your questions, please try and bear that in mind, that we can't answer all questions. And unfortunately, we will not in this session be able to tackle any questions on things like carbon emissions or carbon capture, but they may well come up in a future session. So as a little bit of framing for this event, last year, my scientist warning colleague, Professor William Ripple, published a paper which was World Scientists Declare a Climate Emergency. And this was signed by over 11,000 scientists around the world. It made the global news headlines from all over, from Australia, UK, all across Europe. And yet we saw nothing by way of emergency planning in response to that, in response to what was a very significant statement, an endorsement by thousands of scientists. And it wasn't the first time that this had happened. And what's happened since then is that we've seen forests have continued to be cleared in South America. We've seen more and more species going extinct. We've seen the expansion of aviation. We've seen plans to ramp up oil and gas production. And here in the UK, I am ashamed to say we even saw the go-ahead being given for a new coal mine. So it's bizarre that we've had a response of that kind to a declaration of climate emergency. Now, hot on the heels of that came the coronavirus pandemic, which will almost certainly have affected you. You might know individuals who've suffered from it. I can tell you my next door neighbours were some early victims of it. They are well and healthy. But that really brought home to me that the coronavirus pandemic is on our doorstep. But it elicited a very different response from governments and from people across the globe. So we saw countries moving into lockdown, we saw governments uniting, we saw social distancing measures being introduced and people stocking up on food and other essentials to the extent that supermarkets went empty. So why have we reacted differently to these situations? And this is what we will focus on in our discussion. For example, are we seeing the risks differently? Is it that we don't know how to respond to a climate and ecological emergency? Or do we believe the medical science, but not the climate and ecological science? Or is there some other reason? And so our panelists, I'm hoping today, will help us understand why we've behaved differently in response to that. Okay, so the event is going to work like this. Our team will be scanning your questions as you submit them. So as I'm talking and as our panelists speak, please think about the questions you'd like to put to us. Send them in. You can send them in via Facebook, via Instagram, Twitter, or YouTube. Please tell us your name so that if I call out your question, I can identify you. Just a first name is absolutely fine. And tell us where you're from as well, because it'd be really good to get an idea of, where we're reaching and where you're based and how you're experiencing this. Okay, so while you think about the questions that you'd like to submit, I'd like to introduce our panel. And I will go first to Dr. Cameron Brook, who will say a little bit about himself.
Hello. Yes, I'm assistant professor of social psychology at the University of Amsterdam, and I study who is doing pro-environmental behavior, what kinds of people, and in what social circumstances.
Thank you. Thank you, Cameron. So now I'd like to move next to Professor Wändi de Bruin. I hope I pronounced that correctly, Wändi.
It's pronounced Wändi de Bruin, so close. Hi, it's good to be here. My name is, I just said my name. I'm a provost professor of public policy, psychology, and behavioral science at the University of Southern California in Los Angeles. I just moved here from the UK in January, and so this is not the first semester at USC that I had imagined. My research focuses on understanding and informing how people make decisions about risk, including climate change and health. And I am currently running a longitudinal national survey in the United States with my colleagues at USC on how people are coping with COVID-19.
Super, thank you. Okay, so the next panelist I'd like to introduce you to is Professor Susan Meeke from UCL.
Hello, I'm Susan Meeke, Professor of Health Psychology at University College London in the UK, and also Director of its Centre for Behaviour Change, which is a multidisciplinary centre that's committed to bringing different disciplines together to understand behaviour and how to change it. And also to translate that academic expertise to policymakers, planners, citizens, the outside world, who can use that information and knowledge. And I'm also on the Behavioural Science Advisory Committee, advising the UK government on COVID-19, and also acting as a consultant in behavioural insights to WHO on COVID-19. And the research I do is mainly to do with health and environmental issues. You're mute.
Thank you. Sorry about that. Okay, so now moving to our fourth panelist, which is Professor Lorraine Whitmarsh.
Hi, everyone. I'm Doreen Whitmarsh. I'm a professor of environmental psychology at Cardiff University in the UK, and I'm also the director of the UK Centre for Climate Change and Social Transformations. My own research has really focused on public engagement with climate change, trying to understand what people think about the issue, how we can communicate it, and how we can change people's behaviour to mitigate and adapt to climate change. And that's really a major part of what we're doing in the centre as well.
Super, thank you. Okay. Right, so we've had all the introductions from our panel. I'd like to move now into the first question. So some of these have been submitted in advance by people who were aware of the event. So the first question then is for Dr. Cameron Brook, and this comes from Rosalie in the Netherlands. I'll read the question out. So she asks, do you think there are commonalities between climate denial and climate and ecological apathy, and the failure of some people to take the coronavirus seriously? And if so, might climate deniers also be the same people who do not take the pandemic seriously? And how can we break through denial and apathy? So I'll hand over to Cameron to spend a few minutes addressing that. And thank you, Rosalie, for that question.
I'm ready to answer, but I don't think I'm being shown.
And you're on the screen now, Cameron. Thanks. We just had a bit of a delay there, but thank you. Go ahead.
Excellent. Thank you for this question. Yes, there are some relationships actually, but we should pause first because people can be disengaged or apathetic around climate mitigation or action. And that can be quite different from denying the scientific consensus. So I would say the easier case is when people are just a little bit inactive, and we need to activate them by giving them the right information, showing them that other people are acting, providing simple, clear messages repeated often by a variety of trusted sources. But denial is a little bit tricky. So the first thing is the research does suggest there are commonalities between people who believe in conspiracies of one type or another, who deny scientific consensus. So whether we can be a little bit kinder and call them skeptics or people who are hesitant about the science, or we use a heavier label. There is some evidence that people who believe in one, kind of conspiracy theory around September 11th or faking the moon landing or anything else are more likely to believe in other types of things that contradict scientific understanding, including climate change, vaccine hesitancy, or fringe beliefs about coronavirus and where it originated. So I think Karen Douglas and Stephen Lewandowski are two of the psychologists doing some high quality work on conspiracy theories, and I recommend that. And the last part of your question was about advice. So one of the things that Lewandowski has found is that if you help people understand the specific mechanisms underlying how a process came to be, if you can help them understand, for example, how greenhouse gases work in a simple and vivid way, then that can make it easier for them to come in line with the scientific consensus. And another thing about that consensus is that Sander van der Linden and others have suggested that communicating the consensus itself repeatedly and from a variety of trusted sources is helpful, just to say over and over again how much the scientists agree on certain key issues. And last, I'll just say, whenever we're communicating with people that have different belief systems, or even sometimes it looks ridiculous for them to hold certain beliefs, I would very strongly urge not to make them feel stupid or excluded in any way. That this is a big camp, and we need to be doing it together, and we can welcome them and help them at whatever stage they're at.
Thank you. That's a very interesting answer, and I think it's very important, the points about consensus, but also about not making people feel silly. And I'm reminded of a comment made in an exchange which involved a number of individuals, and one eminent scientist mentioned that actually the key thing is the 60 to 80% of people who are seemingly unaware of that there is a climate and ecological crisis. Of course, we all know about coronavirus and the pandemic, either unaware and not necessarily in denial. I just wondered if any other panelists would like to comment or augment that question that Rosalie had posed. Would anyone like to add anything to Cameron's response? Lorraine, thank you.
Yeah, I mean, I think we did some polling in the UK last year and found that actually the majority of the public in this country do think that climate change is a significant risk and do accept that it's an emergency. So I think that there is a reasonable degree of, it's not quite a consensus, but a lot of people, the majority of people do accept it. I think that the work that we've done around skepticism, though, has suggested that the people who really do deny climate change and say that it is not a human-caused phenomenon, they generally hold right-of-centre political views, and it seems to be that really what's going on there is that people, those people they find the messages around how to tackle climate change really threatening to their worldview and their politics. So the idea that the government should be intervening to change individuals' behaviour, to get businesses to change what they're doing, this kind of sort of interventionist approach that seems to be required if we're taking climate change seriously is very threatening, I think, to people that hold that more kind of free market, kind of right of centre ideology. When we did some work kind of trying to reframe the issue to talk about other sorts of benefits to tackling climate change, for example, that there might be green jobs, there might be some benefits to the economy, that maybe there would be some national security benefits, for example, those sorts of ways of talking really resonated with those groups. And actually, we found that it reduced their skepticism when we talked about climate change in that way. So I think if we can actually find different ways of talking about the issue that try and overcome that initial ideological threat that people feel, actually we might have a more open debate, and we might actually make some progress in engaging with those groups. So I think reframing is one of the ways we can maybe make some progress here.
Thank you. And I think that's really important given, when we look at the political climate and we look at the what's happening globally, not just in the UK, but across the other side of the pond in the US. Okay, so I'd like to move on now to the next question. This is an anonymous question from someone in the UK, and this is a question for Wändi. So could you tell us about the efficacy or otherwise of the messaging that has been used to communicate the climate and ecological emergency versus the coronavirus pandemic? There has been much criticism, for example, of the latest government messaging, which subtly seems to have shifted the focus and the locus of responsibility from the government to the individual. Why has this messaging not been adopted with the climate and ecological emergency, and should it? Okay, so over to you, Wändi, for that one.
Yeah, I noticed, I'm in the US now, but I noticed that the UK messaging now is stay alert, control the virus, and save lives for COVID-19. And those may be very simple words, but it doesn't necessarily follow the recommendation from risk communication to make your messages clear, consistent, and repeated by trusted sources. I mean, it's not necessarily clear what people need to do. And so if you look at the response to COVID-19, initially when countries were closing up, the message was very clear and consistent, stay at home. And we see in surveys across countries and across US states that when the message clearly was stay at home, and when stay-at-home orders were implemented, people were following that, and you saw the success of that message in the curve of hospitalizations being flattened. Now that countries are opening up, the messages are becoming more mixed and people are more confused and uncertain about what to do. And I think there's a lesson here for climate change, because with climate change, I think a lot of the messages about what you can do about it haven't always been so clear. And so, for example, in surveys I've done in the US, I found that even people who really want to do something about climate change do not necessarily know the best thing that they can do in their home, for example, to curb climate change. So families are arguing about turning off the lights and who left on the lights. And it's a big deal for a lot of families. And of course, it's a good idea to turn off the lights, but really bigger things you can do in your home are to blast the air conditioner less, or to line dry your clothes instead of using the dryer. And then similarly, in surveys in the UK, we found that people who are motivated to do something about climate change when they're making food decisions tend to focus on reducing packaging. Again, that may be a good thing, but the biggest thing you can do to reduce your carbon footprint in your food decisions is to eat less meat. So we're really seeing a lack of clear, consistent messaging. And I think part of that is also something that was already mentioned by Cameron and Lorraine, is that a lot of the messaging has been focused on convincing the people who are climate skeptics, who are, a minority. And so I think we've been, with climate messaging, been ignoring the majority who wants to do something about climate change, is concerned about it, but doesn't necessarily know what to do. So clear, consistent messages are needed.
Super, thank you. Okay, so just a reminder to everyone, if you've just joined us, we are now almost 20 minutes into our second Ask a Scientist live session. We have 4 panelists, and we're looking at the reasons why, or trying to understand psychological reasons and backdrop to the different reactions to the climate and ecological emergency and the coronavirus pandemic. Okay, so Wändi, I just have a question, if you don't mind. Every time you guys speak, I'm thinking of an interesting question. Do you, when you talked about the inconsistency in terms of what people are doing and the confusion, do you think that's partly because the science isn't clear? Because sometimes that's felt to be, I hear people, saying, well, one person says this, one person says that.
I think that with COVID-19, that is definitely the case. Now that we're trying to open back up, I mean, the scientists are learning about this crisis as it's evolving. And so there is a lot of uncertainty, and we're learning from the things we're implementing. And so there's definitely partly that. With climate change, I think the mixed messaging doesn't necessarily come from the science being unclear, but different scientists focusing on different messages, and that creating a lot of confusion. And there may be, there may be some uncertainty about details, about is it better to use to eat it. I'm not going to give an example, but there may be specific details about a specific product, whether it's better or not than a specific one, but there's some general rules where the scientists agree that, for example, eating less meat is generally a good thing to do. So the message hasn't been consistent between scientists, but I think the science is clear for climate change.
Thank you. I think that's a really important point for our listeners to know. Now, Susan Meekie would like to pop in with a comment here. Susan, feel free.
Thank you. Yes, I think in the case of COVID and this recent messaging in the UK, I don't think it reflects differences between scientists. I think that science is always within a social, political, economic context. And I think my guess, or a lot of people are suggesting this, that it's really reflecting different opinions as to whether the public health issue is the most important one right now, or whether the economic issue of getting people back to work is the most important one. And I think public health scientists and the scientists involved around it are thinking that there really isn't this sort of tension until we can suppress the pandemic. Then the economic future is not assured. So I think in this case, the mixed messaging and the inconsistent messaging, I think, reflects tensions more at a political, ideological, economic level than at a scientific level.
Thank you. I think that's a really important point, because clearly, you know, I think what the public is saying loudly and clearly is that they want governments to prioritise health over wealth. And yet it seems that perhaps that message hasn't actually landed particularly well with various governments. Susan, I'd like to stay with you. We have another question now. And this comes from an XR supporter. And the question is, what is the place of nudge theory, which we've heard a lot about, in the success or failure of mitigation policy? And what are the implications for public action on climate change? And so I put that question to you. Could you please, for those of us who aren't as clear on nudge theory as I'm sure all of you experts are, just very quickly explain to us what's meant by nudge theory?
Sure. Well, first of all, nudge isn't a theory. Nudge is the name of a book. It's a name of a collection of techniques and a particular approach to changing behaviour that emphasises small changes in local environments, changing things such as defaults, cues and triggers, often operating at a, not at a conscious level, trying to shape people's behaviour, often without them being aware of it. And while it has a role to play within public policy and behaviour change, it's only some techniques, and it certainly isn't linked by any theory or a general theory. What's not in, what wouldn't come under the nudge techniques would be, for example, financial incentives, which we know is hugely important in any change at a population level, or whether it's of industry, whether if it's citizens, whether it's of public organisations, etc. And the other thing that it deliberately excludes is regulation. And of course, we know regulation is absolutely fundamental to dealing with the climate emergency and dealing with COVID-19. So much better to take a more comprehensive view of all the different kinds of levers that we could use in terms of changing behaviour. There are many different frameworks. One that I've been associated with developing, called the Behaviour Change Wheel, was developed as a result of working with policymakers in our Department of Health and realising a lot of the frameworks were quite partial. So we looked at all of the literature and identified 19 different frameworks across many different types of domain. And there was a lot of overlap. And so we put them all together and came up with this framework, which is 9 basic types of strategy for changing behaviour. So it could be persuasion, it could be giving information, it could be incentivization, etc. And 7 types of policy option that supports those. And at the hub of this is a model of human behaviour, COMBI, which stands for capability, opportunity, motivation and behaviour. So in order for any behaviour to occur, there needs to be the capability, the physical capability and the psychological, the knowledge and skills. There needs to be the motivation, both the top-down, reflective, conscious decision-making, but also that more unconscious, emotional type of motivation. And then thirdly, the opportunity needs to be the social and the physical opportunity for behaviour to occur. So by understanding behaviour context and understanding do one or more of these need to change this behaviour, it then points you in the direction of what type of intervention strategy, what type of policy option will be likely to be most effective in bringing about behaviour change, whether that's in individuals, in communities, or across whole populations.
Thank you. That's a very comprehensive answer. I would like to just jump in with a question there. For many of us, a key issue is the overconsumption by a small percentage of the global population, the 10%, as many people put it. And I'm curious as to how we would apply behavioural change framework to persuade those people who are over-consuming to stop doing that so that others can basically live.
When you have a real difference in power, I think persuasion isn't enough. I think one has to do more than persuasion. I think the COVID-19 pandemic has shown many societies to lack resilience, to actually be very fragile. And this is for many different reasons. But one of them is actually the way in which we distribute wealth across society. So certainly in the UK, what we're finding is our public services, our public health infrastructure is woefully inadequate to be able to deal with the kind of testing and tracing and to deal with getting the equipment and the right things to the right people at the right times. And so I think as we come out of this crisis, I think it's going to be incredibly important that people really step back and firstly think, what is really important to me? And people are really beginning to say, as you say, health and well-being are overwhelmingly more important than the economic wealth issues. Secondly, who are the essential people in our society? This is really showing who they are. The people, the carers, the people who are doing the delivery, who are cleaning the streets, etc. And thirdly, how can we reorganize our society? Because this won't be the last pandemic, and we may be living with this for years in different ways. How can we reorganize our society so it becomes more resilient for everyone? And then that is in the interest of the 10%, just as it is in the interest of the 90%. And the idea that the 10% can carry on living in isolation, I think is becoming less credible, and hopefully to them, that individuals are interconnected, communities are interconnected, and indeed countries are interconnected.
Super, thank you. Thank you. Okay, questions are coming in, which is great. So do keep sending your questions in. I'm seeing some really good ones. Can't wait to get to them. I have one now from Celine in France, and this one is for Lorraine. It's about the role of feedback in changing behaviour. So immediate feedback seems to be necessary to reinforce behaviours. So for instance, people make a connection between lockdown and then actually seeing the number of deaths decreasing. So does the panel agree that it does not bode well for the fight on the climate and ecological front, where impacts of behavioural changes we make now may take years to be seen? And what can we do to address this? So this one is for Lorraine.
Yeah, okay, thank you for that. I think that's a great question. And I agree, I think lack of feedback on our behaviours, it definitely can be a barrier to action. So we know that an important way to change behaviour is by reinforcing good behaviour and punishing bad behaviour, and doing so immediately following that behaviour so that people can associate the outcome with the action. And so where there's no obvious negative outcome from our behaviour, we'll be less likely to stop doing it. And so I think that maybe partly explains the COVID climate change difference, but not fully, because I think there isn't actually an immediate response to measures like hand washing or lockdown, for example. In many cases, they do take some weeks to see the effect, and the effect may be more collective than individual. But I definitely agree that sort of delay is much more pronounced for climate change, where collectively the benefit of reducing emissions will take many years to see any impact, and probably many decades. And similarly, studies of energy use show that the invisibility of energy, as well as of its impact on climate, can be a barrier to change in behaviour. This is why if you give people energy real-time feedback through energy smart meters, it can help reduce energy use by between about 5 and 10%, because it helps show immediately the difference it makes. For example, if you put less water in your kettle than you would normally, than waiting, say, 3 months for an aggregate energy bill. So giving people that kind of immediate feedback really can help make the connection between your behaviour and the impact that it has. And so I think addressing this then in terms of, this is the last part of the question, how can we actually address this this kind of gap between our behaviour and outcomes? Part of it could be to do with making our actions, the outcomes of our actions, more visible, more tangible. That could be through using technology like smart meters or apps and other ways of helping to visualise our energy use. But actually, I think an even more effective strategy would be to focus less on the environmental outcomes of our actions and more on more tangible, immediate, personal, social, maybe health outcomes. For example, think about cycling to work. Actually, that can immediately boost your mental health. It can fairly quickly have physical health benefits. It can immediately save you money. So I think actually focusing on the co-benefits, you know, the side benefits of climate change action for the things that people really value, thinking about an immediately obvious one like using teleconferencing, using kind of Skype and Zoom and stuff, instead of physically traveling for work. Well, you can spend more time with your family, maybe it would save you money. All of those sorts of immediate benefits, I think that's really what we need to probably focus on in order to motivate people to adopt lower carbon habits. So that would be my kind of main suggestion.
Thank you. And that's great. Some very useful information there as well. And obviously, I think it's important that there's a balance between the extent to which people feel they have to be responsible for changing their behaviour and also the policy-led work and the importance that governments do the right thing. Okay. Now I'd like to come back again now, and we have a question that's just come in, which I'd like to put to Cameron. And this is from Lucy in the UK. It's quite a contentious one, this one. Why are politicians seemingly guided by the science on COVID-19, but not on the other crises, like the climate and ecological emergency? Are governments actually following the science, or are they using it as a way to avoid scrutiny on their policies?
Well, that is a thorny one. And I'd be very curious to hear what Susan would say to that. But I have one quick thought, which is just that politicians will, they will do whatever we hold them accountable to do. So to the extent that there is a public demand across the board for some prioritization, whether it's economic or military or around some crisis, then they respond to us. It's not a separate system in a way. And I think the immediacy of the COVID crisis and the way that we're counting the outcomes, for example, in deaths, as opposed to with climate, when we're currently counting it in terms of, atmospheric concentrations of invisible chemicals, it makes it tangible and vivid, and that can help the public and the policymakers react to it more quickly. But could I pass to the panel? I'd love to hear some other thoughts.
Right. Yes, absolutely. And I think in terms of the, politicians will do what they're accountable for. Of course, the issue is there, how do we hold them to account? And some seem less accountable than others, but we won't go there just now. Susan, would you like to jump in at this point and comment on that question?
Yes, thank you. I don't think policy or politicians ever follow science. I think the issue is that they may be informed by science to greater or lesser extent. And I'm very pleased that the UK government is listening to scientific advice. However, it's very difficult to know the extent to which the scientific advice that is given actually ends up in policy, because obviously the decisions are influenced by many other ideological and economic factors. And I think the concern of many scientists is whether sometimes they're being used as a fig leaf or as a scapegoat for when things go wrong. So I think it's a complicated relationship. And I think the key thing is that there should be real transparency and openness for the sake of both scientists, so they feel that they're being respected and not being abused in any way, and also for politicians, and importantly for citizens and the general population, so they can see what are scientists actually saying and what are politicians actually doing as a result of the advice they've been given.
Thank you, Susan. Anyone else like to jump in there with that question? No, okay. Okay, so we are now just over halfway through our Ask a Scientist live question, brought to you by XR Scientists. I'm Alison Green, and I'm with a panel here, which includes Cameron Brook, Lorraine Whitmarsh, Wändi Bruin, sorry, Wändi if I pronounced that incorrectly again, and Susan Meeke. And we're discussing why it is that people, governments are responding differently to the coronavirus pandemic, why the response has been different to this than it was to the, or is to the ongoing climate and ecological emergency. Okay, so I have another question here, which I'd like to put to Lorraine, if I may. Obviously, if you would like to pass it on to someone else, that's fine. So this is from someone in France. Now, when the coronavirus pandemic broke out in the UK, the government first just advised staying home and limiting travel. And then there was then very little change, it seems, for about a week or so, until there was actually a clear policy to require everyone to do the same thing, which meant closing pubs. So we effectively had a lockdown, but it took some time for that to happen. Then there were sudden dramatic changes in people's behaviour. So the question from Lorraine in France is, what is holding our leaders back from giving clear policy to require fair, universal behaviours from the public in the face of a climate and ecological emergency? So clearly they've done certain things and they've put in place certain measures for the coronavirus pandemic, which is killing many thousands of people. And yet potentially we may, within our own lifetime, see millions of people globally die as a result of the climate and ecological emergency. So why are we not seeing these responses from governments? So if I may, I'd like to put that to Lorraine, but others do please chip in if you'd like.
Yeah, thanks. Another really good question. And I think we've touched on some of this a little bit earlier, because I think, as Wändi said, actually, I think part of this is about having a really clear, consistent message. And if you're sort of saying, well, we'd quite like you to stay home, but it's, you know, optional, then probably people are thinking, well, it's not really very serious and I don't see anyone else around me kind of changing their behaviour. So part of this is about the clarity of the message. And actually part of it also is about social norms. People look very much to what other people are doing. And it wasn't really until the message was very clear, stay home. And it was a requirement, not a voluntary kind of request, that people then actually realized this is the thing we have to do. There was the clarity, and actually other people were starting to conform, so they conformed also. So I think that's clearly kind of shed some light on why that worked better in the sort of when it was a requirement. But yeah, coming to climate change, I think it's not unfortunately quite so simple, because although we kind of said earlier, well, we kind of know the sorts of things that we need to do to tackle climate change. Actually, it's not really the case that you can just say, this is how we get to net zero, and we're just going to impose it on people. We do actually need a sort of a societal debate of, to some extent, on how we reach net zero. And there are different options. You can have certain types of technologies, and there are choices there. You can have certain types of lifestyle change and different sorts of ways that communities are configured and so on. So there isn't quite I appreciate there's definitely uncertainty in how we deal with climate, with COVID also, that's not necessarily a clear-cut sort of set of measures that could be put in place, but there's probably a bit more clarity about the sorts of things that we need to do to limit the impact of the pandemic than there is necessarily for addressing climate change, when there are more choices available there. So we need to bring the public on board in decision making about how to address climate change. I think this is why it's really important we're seeing citizens' assemblies and other sorts of kind of deliberative discussion and debates that bring the public into how we do that. And actually then you can actually get people to buy into those solutions. And so I think that's a really important part of how we tackle climate change, is actually getting people on board and coming up with those solutions. And then we know we'll be doing it in a way that is more kind of socially robust, that does actually work for people, that they'll buy in and they'll conform. So I think it's a bit different, hopefully, then.
Thank you again, a very, very comprehensive answer. And I hope people listening that your questions are being answered. We've got one's just come in from Instagram, and this is from Zane, who hasn't given his or her country, but I think it's an interesting question. I'm not actually sure which panelist to put it to, so I'm going to read the question out, and then if you'd like to take it, please just pop your hand up. It is an interesting one. The question is, do you think society would be more inclined to take crises like the climate and ecological crisis more seriously now that we've experienced the pandemic? And they said, right, once bitten, twice shy kind of thinking. Would anyone like to respond to that? Susan, thank you.
Well, I can have a go in that I think there's interconnectedness in terms of the extent to which we're likely to get pandemics in the future. I think the more the ecosystem is destroyed, the more likely we are to have these kind of pandemics with viruses jumping from animals into humans. So on the one hand, there's a relationship there. And on the other hand, there's also a relationship with new opportunities coming out of COVID to really tackle the climate emergency by carrying on with some of the things that we're not doing now, you know, in terms of the consumption, the flying and other aspects. So I think a lot of this really depends on what governments and what different communities and groups of citizens can do in terms of making connections. But if we can make the connections that these two are really interlinked, then I hope we can keep the momentum going of together, in the end, we will have defeated this virus, to together, in the end, we can defeat the climate emergency.
And Cameron, thank you. Would you like to come in too?
Yes, I agree with that. And I just want to add a little note of optimism here, which is, I think we're all realizing that large-scale behavior change is more possible than we might have thought. We've seen our neighborhoods and our communities and countries really transform in the blink of an eye in a way that, you know, some climate scientists have been asking us to change for a long time and haven't seen a lot of progress. But a huge scale change is possible. And that frees us in a way because, you know, behavior change in our own lives is easier to make during a disruption. If you want to try and change how people commute, it's very difficult to give them information. You know, maybe you could get there faster on the bus, or it's difficult, but it turns out it's easier to intervene right when they move house. So, you know, they're already looking around and saying, well, what should I try now? And this is a moment of huge disruption to all of us. So it's a moment when we can look around and say, well, what can I do in my personal life? And how should we shape our communities, like Lorraine was talking about? So
Can I add? Oh.
Just very briefly, one more thing, which is there's a set of behaviors that affect both crises that help us manage both COVID and climate change, like eating less meat. That caused, it seems that eating meat caused the 1918 Spanish flu as well. And that was farm grown meat. That wasn't even from some strange wet market. Flying less, etc. Yeah, Wändi?
Yeah, I wanted to add to that I live in Los Angeles, and this is a city with a terrible traffic problem and a lot of air pollution. And now that we're all stuck at home, there is a lot less traffic and a lot less air pollution, and presumably less CO2 emissions. And my colleagues are saying, oh, I have so much more time in my day not sitting in a car all the time, and I can open my windows and I enjoy the fresh air. And so I'm hoping that seeing that we can make a change together and have positive experiences as a result of it will be able to be translated to the climate crisis as well.
Great point. Yeah, and it reminds me of a point made by Naomi Klein. She frequently talks about disaster capitalism and talks about how it's so important at the moment that we have this window where governments have been saying that they could not respond, as if there was a magic button they could push and stop the economy. Well, actually they can. They've shown that they can do that. And I really like Cameron's comment about the fact that we've seen now that behaviours we did not think possible are in fact possible. So we can, there is cause for optimism in terms of what we are capable of doing. Whether it will be enough is another matter. But yeah, great question, and thanks. Some really great responses there. I would like now to go to Cameron again, if I may, but feel free to pass this on to someone else if you think this isn't quite the right one. I hope I'm not repeating myself with these questions. But this is very much a psychological question. So we know how to feel ill. We know what it means to feel ill. We know how to behave, what to do when we're unwell. You go to the doctor, take some medicine, whatever, go to hospital. But we don't seem to know how to react when the patient is the planet. Is it possible that there are certain differences between the climate and ecological emergency and the coronavirus pandemic that just make it harder for people to make sense of the former? And feel free, I'll put it to Cameron first, but if anyone would like to chip in, please.
No, that's absolutely right. And scientists have been writing about this for a while. And I think one of the biggest things is that climate is always going to be a statistical abstraction, which is very difficult to grasp. So your own health, how you feel, whether you can breathe, is so immediate. You couldn't really imagine anything more vivid than that. In the same way that in any of our personal lives pre-crisis, you're going through your life and you're worried about this or that, or I don't know. And then if somebody close to you falls ill, that's the only thing that matters. I mean, it just takes up all of this space. And that's what we're experiencing communally now with the pandemic. That climate change is not so immediate, it's more abstract, that it's long-term. The CO2 we're pushing into the atmosphere now isn't going to leave and have its biggest effects for another 30 years or something. Don't hold me to that, but it's a long-scale process. The feedback is really slow. For those and other reasons, it's very difficult for us to grasp, but that's when we need to communicate clear messages about impacts, about consensus, about things that we can do. And I really like the focus on co-benefits, all these things we can do that improve our life right away and in ways that we want. They also happen to help the planet.
Thank you. Susan, would you like to add to that?
Yes, I completely agree with the points Cameron made. I think also it's worth adding the idea of complexity. I mean, everything is complex, but I think the issue about a virus that is either transmitted by somebody sneezing or coughing into your face and it getting into your eyes, nose or mouth, or by touching a surface with the virus on that you then touch, that then you touch your eyes, nose and mouth and it goes into your body, is quite a simple linear transmission that one can understand. And therefore one can also understand this makes sense in terms of how I block the transmission. I catch my sneeze or cough with a face mask or a tissue. I wash my hands. I don't touch my eyes, nose and mouth, etc. When it comes to the health of the planet, it is so complicated. There are so many things that are going on. And even if we think about the hundreds of thousands of people who are dying, every year because of, even probably in one country, because of atmospheric pollution. The problem is that they're dying because of lung disease, they're dying because of heart attacks. These things can also be caused by other things. So there's not this nice one-to-one translation. You can say that was definitely that carbon emission that killed this person. Whereas COVID, it's virus into the body, people die from it. It's much simpler, and it's much simpler connecting up what's caused it and what you do about it. Again, that's much more complicated because often it's government ideologies that are sort of behind the causation. That's very different than what can individuals do about it.
Can I add to that too? So I think with the climate change, there has been a change over the decades in that it has felt or has become to feel more immediate to people I think increasingly people in different countries in the world are reporting that they are now feeling that climate change is happening in their countries and affecting their communities. So in the UK, people are concerned about increasing rainfall. In the US, people are concerned about the increase in heat waves. And so at least the immediacy of the problem, I think, is more apparent to more people now. But the complexity still makes it difficult for people to decide what to do about it.
Super, thank you. Okay, 9 minutes to go. I think we have time for one more question. I'm going to pick on one which has come in from Doug in Berkeley, California. So we haven't had a question from someone in the States yet, so I'm picking on this one. It may or may not be appropriate to this discussion, but I'll put it to you. Please, he asks if you'd please comment on the pros and cons of framing the problem of greenhouse gas emissions in the theoretical framework of the tragedy of the commons and its consequent strategies for problem solution. Does anyone feel that equipped to take on that particular question? It might not be a very psychological question. It might be more to do with greenhouse gas emissions, which would more be one for the climate scientists. So I'm not seeing any take. Oh, it's Lorraine. Okay, thank you.
I can have a go. I mean, I think it probably speaks to this issue of sort of psychological distance, which, you know, several people have already spoken about, which is that, you know, it's global, it's long term, it's really hard for people to connect to. So I think the more we kind of really focus on the fact that it has those properties, the more it is difficult for people to relate to. So I think we need to kind of bring it down to the individual level and to, as we've talked about, kind of connect individual behaviours with outcomes and, you know, show people why there might be other reasons to act. So I mean, climate change obviously is a collective problem. It is, in a sense, a tragedy of the commons. So we do need to have kind of international action, but we also need to have action at the local level and at the individual level. And I think if we're talking about motivating people, that's just where my own kind of work focuses on sort of individual action and behaviour change, then it's at that more immediate level of, you know, showing the individual benefits of action that are where you can motivate people. So I think that's bringing it down to the local is kind of maybe the way I would choose to frame it.
Okay, does anyone else like to add anything to that particular question? Cameron, thank you.
Well, whenever I talk in public about the tragedy of the commons and social dilemmas, which I think match the issue very well, people often want me to talk about Elinor Ostrom and resolutions of the tragedy of the commons. So I just want to shout out that just because it's a commons problem does not mean it leads to a tragedy. You have to have communities and clear understanding of consequences, and then you can develop rules and you can help resolve them, so that can still be a good story in the end.
Great, thank you. Okay, we are running out of time now, so I'm wondering whether we should just move straight into a kind of summary. What I'd like to do is ask each of you to reflect on your experience of working within the climate and ecological emergency, and then suddenly we're jettisoned into the coronavirus pandemic. And I'd just like to ask each of you in turn just to give us some thoughts and some headlines and some key messages that you would like listeners to take away from this particular session. So Cameron, the camera's on you, if you don't mind. Could I start with you, please, for some reflections, observations? Just take maybe a minute to do that.
Well, I've really enjoyed listening to the other panelists, and I think what there is to take away is that we see how much potential change we can make, and we can focus on the individual level. And, you know, as psychologists, we often focus on trying to study individual behavior change, and we can focus on system level changes. And where do they come from? Well, public policy is quite complicated, as Susan was helping explain, but in part they come because of what we demand and what we expect. So one of the funny things is that CO2 emissions during the lockdown haven't gone down all that much. And that shows you how much this is not an individual level problem alone. That is to say, we need structural, we need planning to change how things are organized. So I see that that's possible through the coronavirus response, and I'm hopeful for the future.
Thank you. Okay. Wändi, could I move to you next?
Sure.
Thank you.
Yeah, so I think that what we've seen as a result of the COVID-19 crisis is that if there are clear, consistent, evidence-based messages, people can change their behavior and come together and obtain a positive outcome. And so I'm hoping that we will be able to learn from this and implement this approach for attacking the climate crisis as well.
Super, thank you. Okay, I'd now like to move to Susan, if I may, for just some comments from you, some reflections, maybe drawing on your experience of being on those two really important committees.
A couple of points. One, I think a huge amount of learning as a result of trying to apply what one knows to a completely new situation in a context where everybody is trying to do the same thing. And so one of the things that I've really personally benefited from is interactions with many people from different sectors, different disciplines, different backgrounds, all trying to problem solve together. And that collective thinking and action has been wonderful. And on a bigger scale, I think the other thing that has deeply impressed me is the collective solidarity of populations in really challenging, difficult circumstances, coming together, helping each other, and amazing examples of generosity and altruism. And it really reminds me that human beings are essentially good, and social relationships are essentially good. And we need to find that. They get distorted by things around us, but I think it's really shown that. And the final thing, I think, is the importance of community. In my climate change work, we're working with communities, with community participation to generate solutions to change whole cities, bring about citywide transformation. I think one of the things that our government in the UK hasn't done well enough is community engagement, really learning from, mobilizing communities to solve problems. It's not just a question of spinning messages to passive audiences. So I think respect people, involve people, and learn from people.
That's very uplifting. Thank you, Susan. Lorraine, would you like to give us some reflections and some comments, please?
Yeah, I mean, that's hard to follow. I agree completely with what Susan's just said, but I think I've been working in the area of habit change, habit disruption, and the idea of moments of change as opportunities to intervene to create sustainable lifestyles increasingly over the past few years. And because we know that actually habits are a really big barrier to behaviour change, and that if you intervene at times of disruption, as Cameron mentioned earlier, like when someone's just moved house, you can more effectively change habits. Well, COVID may be the biggest moment of change, the biggest disruption that we have ever seen. And while it's obviously a tragedy and brings so many negative sides to it, it has also created some low carbon habits. People are traveling less, they are consuming differently, maybe less in some ways. And so we need to maybe think about how we can retain some of those low carbon habits beyond the end of the lockdown and into the kind of post-COVID era. And so we need to lock in those good habits, I think, with appropriate infrastructure, incentives, norms, all the things that are part of Susan's behaviour change framework, for example. And I think also a really key part of how we do that is aligning those strategies with ways in which we can become more resilient to COVID and those sorts of kind of health risks too. So really, I think it is about finding those common solutions that improve our resilience to climate change, COVID and other things, and that bring all those co-benefits that we've talked about. So I'm hopeful that we can do that. And I think there's this is a great opportunity in many ways to try and reconfigure our society in a low carbon way.
Thank you. Thank you. Well, I'd like to thank all of you for participating. It's been a really interesting discussion. It could have been quite a depressing one, given that we are in a climate and ecological emergency, which just is bad. And we are still in the midst of a coronavirus pandemic. I think what we've shown is positive aspects of human nature and the positives around what we can do. I think a really key point is that one about we have to hold those with power to account. We absolutely must do that. There's no point in being passive. You know, we can effect change. So thank you, everyone. And again, thank you to our amazing tech team who made this possible in a short space of time. I just want to give you, just to queue up the next event, which will be agroecology. Can we feed the world without destroying it? I'm sure that'll be another fascinating discussion. We don't have a date for that yet, but it'll be announced through Extinction Rebellion, XR Scientists, social media. So that's us done. Thanks everyone for all of those super questions that came in. I apologise for not being able to address them all, but we've tried to cover a cross section from people around the globe and different countries too. It's been my pleasure to be here to talk with you. I hope to see you again soon. Thank you so much.
Thanks so much for joining us for Ask a Scientist Live and all your questions. Unfortunately, we weren't able to answer them all, but thank you for submitting them. But please, we'll be back for another episode very soon. And for more info, please follow the following websites: www.scientistsforxr.earth, follow us on Facebook, Scientists for Extinction Rebellion, or on Twitter, ScientistsX.